Okay. Thank you very much. And is my presentation visible?
Yeah, it is just displayed as full screen, please.
Okay, thank you very much. My name is Francis Levira. On behalf of my team in Tanzania, I would like to present on Tanzanian experience with regards to urban-rural linkages in the time of COVID-19. So I'm going to present the case of Dar es Salaam. So this is the experience from Dar es Salaam, but it was also experienced from many parts of Tanzania and urban areas. So the content of my presentation, I will start by giving an overview on the governance structures in terms of local government and health system provision. And the next one is on urban neighborhoods and classification and the linkages. The third will be on pandemic response in terms of governance. And the other one will be on pandemic response on preventive measures. Then on pandemic response in terms of treatment, and lastly on challenges. So in terms of governance structure, the government of Tanzania is organized into different ministries. So if you look at the chart, you have government of Tanzania, and then below it you have a ministry that is responsible for the local government. So it is under President Office. So we call it President Office, Regional Administration and Local Government. And below that you have now regions as administrative areas. And below regions, you have districts. So there are districts in the rural and district in the urban. So when you come to the urban districts, then you have municipal, or we normally call them districts, and then you have wards, and then the last one in terms of neighborhood is street, which is what we will consider in this presentation as neighborhoods. So in terms of health service provision structure, we have two major ministries responsible for that. You have Ministry of Health, Community Development, Gender and Children, and then you have President Office, Regional Administration, Local Government. So when you look at this organization, then you find that the Ministry of Health is responsible for the administration of different departments like medical store departments, health insurance, and then you have the ministry also is responsible for overseeing the specialized hospitals and referral hospitals, and then we have regional hospitals that also are supported by the Ministry of Health. And then you have the President Office, Regional Administration and Local Government, which is actually responsible for the implementation of routine activities like district hospitals. And then you have primary health facilities like dispensaries, district hospitals, and such. And then you have other ministries that are responsible for the financing, Ministry of Finance, and the other ministries. So in terms of staffing at different levels, at the district level, we have government employees. At the district level, you have district executive directors, and there are employed staffs in all sectors. And at the political level, we have member of parliament. So per district, you may have one or more than one member of parliament. So when it comes to the lower level, which is ward, then we have ward executive officer. So ward, as I said, is a combination of different neighborhoods or streets, And within wards, we have about 3 or 4 government employee positions. We normally have health officer, education officer, a community development person, and 1 or 2 more employed staff at the level of ward. So down at the bottom on the neighborhood, which is actually the street, we have only 1 employed person, which is the street executive officer or neighborhood executive officer, only 1 person. So you can start imagining on the staffing side of it. So in terms of how the cities are organized, we have different neighborhood classification. We have already analyzed our data, and you can see the map here are different types of neighborhood, starting from the low income neighborhoods to the super or high income neighborhoods. So in Dar es Salaam, we have currently 5 municipals or wards. And actually the last 2 ones were divided from the other 3. So we don't have actual number of wards and street. So in terms of urban-rural linkages, the linkages are major coming from the labor market. So the rural would normally supply cheap labor to the urban. Some people are moving to the urban due to the economic opportunities. So it is back and forth. And we have internal tourists, people who are just coming to Dar es Salaam to visit their neighborhood. We have also education that is also increasing the flow. Many institutions, high institutions are in Dar es Salaam, and people are maintaining their family ties. So people will go to the rural, and the rural people will come to the urban. So most migrants are living with their relatives, especially in people of the low class. So you can see relatives, proportion of relatives compared to the children, it's almost 75% of people are living as relatives in low income household compared to the high income household in class 6, where number of relatives or proportion of relatives compared to children are slightly low. So when it comes to the pandemic responses, in terms of governance, we didn't have a specific governance structure to deal with this one. So the country has to establish different committees. Actually, there were 3. So starting with the bottom one is the National Task Force that was consisting of permanent secretary from different ministries. And then we have the top above it was permanent secretarial committees. These are technical people. And then on top, we had a national response committee, which was actually consist of very, very top government officials. So in terms of preventive measures, the government decided to go on more of preventive measures. So we didn't have any lockdown. There was actually a scaled up of education campaigns. Economic activities a little bit slowed, but everything continued as usual. Hygienic practice were insisted, and many places were closed. Education institution and many other gatherings were actually prohibited. So economic activities continued as usual. So people had to make their own mask, and washing hands was actually promoted a lot. So in terms of treatment in Dar es Salaam regions, large public hospitals were designated for dealing with the pandemic. We had different sample collection points, and actually a lot of stigma was also observed, and also the government decided to release some different form of medications. So lastly, in terms of challenges and things that needs to be addressed, including limited funding on education campaigns, as there was no sufficient funding to support that. There was no actually social and subsidies for poor families. As I said, economic activities a little bit slowed down. So some people were laid off, but there was no any support. We also had lack of capacities in terms of testing. We only had one lab that was responsible for testing the entire country. And we had a lot of challenges in terms of the government accepting the diagnostic that were instituted by the were important. So there was a lot of challenges in terms of agreeing on whether those testing equipment were sufficient. So in summary, I can say there was a challenge, but because there was no any lockdown, most economic activities continued as usual. We didn't have any food challenges as experienced with many other countries. So that is the end of my presentation. In short, if there are any questions, I would love to hear from the team. Thank you very much.